in children with tympanostomy tubes. I study nursing school. My name is Carla1 and my teacher is Master Moscoso. Objective: to review evidence regarding antibiotic treatment of acute otitis media in children with tympanostomy tubes and to discuss antibiotic resistance and ototoxicity. Definition. Abstract. Tympanostomy tube placement is one of more common surgical procedures performed in children worldwide. Otorrhea or ear spray is a frequency sequela in children with tubes. It is usually a symptom of a middle ear infection where very fluid that has built up in the middle ear drains down to the tube into the shield ear canal. Acute tympanostomy tubes otorrhea (ATTO) is mildly unpleasant and can smell bad. The underlying middle ear infection can cause general illness, pain, and fever. Consequence. Most episodes of tympanostomy tubes otorrhea (TTO) last 8 to weeks. Some children develop chronic otorrhea, which may cause considerable morbidity and hearing loss. Therefore, it is important that children with ATTO receive the best treatment.
The ear has three distinct parts: the outer, the middle, and the inner ear. Sound waves first travel through the outer ear into the ear canal and then vibrate the eardrum. The eardrum is connected to 3 tiny bones in the middle ear. The vibration is passed to the cochlea in the inner ear, where it is processed and sent to the brain. An ear infection occurs in the middle ear. Normally, fluid in the middle ear drains down the eustachian tube and into the back of the throat. During an ear infection, the middle ear produces fluid that cannot be properly drained through the eustachian tube. The buildup of fluid can cause pain and temporary hearing loss, and it may lead to a middle ear infection. Otitis media is more common in children because of the length and position of their eustachian tubes. Management by a doctor is required to treat this condition.
Pharmaceutical test. We perform an open-label pharmaceutical trial in which we randomize a sim 230 children, 1 to 10 years of age, who had acute tympanostomy tubes authorized to receive antibiotic, glucocorticoid, ear drops, or oral antibiotic, or 2 initial observation.
Pathology of otitis media. When the eustachian tube is blocked due to allergy or infection in the upper part of the respiratory tract, fluid accumulates in the middle ear behind the eardrum. This causes an infection and the middle ear gets inflamed, a condition known as otitis media. The buildup of pressurized pus in the middle ear causes earache, swelling, and redness. Since the eardrum cannot vibrate properly, one has decreased hearing. Also, there is a feeling of fullness or pressure in the ear with dizziness, loss of balance, nausea, vomiting, and fever. Sometimes the eardrum ruptures and pus drains out of the ear. But more commonly, the pus and mucus remain in the middle ear due to the swollen and inflamed eustachian tube. This condition is serious because of the severe earache and hearing loss it can create. Hearing loss, especially in children, may impair learning capacity and even delay speech development. Otitis media is also serious because the infection can spread to nearby structures in the head. Thus, it is very important to recognize the symptoms of middle ear infections and to get immediate attention from your doctor. However, if it is treated promptly and effectively, hearing can almost always be restored to normal. Tips to prevent middle ear infections for infants. Appropriate management of colds, flu and sore throats, and of hay fever and other allergies helps prevent middle ear infections. While breast or bottle feeding babies, avoid holding them in a horizontal position. A semi-inclined position prevents the milk from entering the eustachian tube and infecting the middle ear. Avoid contact of the baby with objects handled by people who have cold.
Background. Recently done for the management of acute authorized children with tympanostomy tube is based on limited evidence for TIA comparing oral antibiotic agent with topical antibiotic.
If you haven't already noticed, spring has arrived here in Florida. Everything is covered in pollen. Patients are coming into central care with itchy eyes, sneezing, runny nose, and congestion associated with allergies. And we're also seeing an increased number of children coming in with middle ear infections. Yes, you heard me right. Middle ear infections are going around at central care. Well, why is that unusual? Because typically we're going to see middle ear infections associated with upper respiratory viruses in the wintertime. And what happens is, either way, whether it's a virus from cold or congestion from allergies, you're going to get blockage in what's called the eustachian tube. This tube that goes up behind the eardrum, here's the eardrum or tympanic membrane, and then this space where the bones are in the middle, or the middle ear here, you get fluid that builds up, and that's what gets infected. Now that fluid can build up either from, like I said, a virus, or from congestion from allergies. Now you can also get outer ear infections, which can cause just as much pain, but typically there's going to be more drainage and stuff. And how can you tell the difference of whether it's an outer ear infection or a middle ear infection with your child? Well, the easiest thing to do is just kind of gently wiggle their ear, press on the front of the ear here, just in front of the canal. If that's tender, it might indicate it's swimmer's ear. Now, as we get into the spring and summer, we're going to see a lot more kids coming in with outer ear infections. The thing to remember is that whether it's outer ear or middle ear, you're going to need to bring the child in to be seen by a doctor, to be placed on either antibiotic pills, which are for the middle ear, so we get the antibiotic in the bloodstream and into that middle ear chamber to cure that infection, or antibiotic drops to put in the outer ear to heal up the ear. So painful ear in a child, get them into central care, get it looked at, get on the proper medication to heal up the infection.
Conclusion. Current evidence suggests that a topical fluoroquinol with or without a corticosteroid is treatment of choice for acute otitis media with tympanostomic tubes. Thank you.